It means a place where I can come and get the medical care I need or be referred to another place to get medical care and be treated with dignity and with compassion.
Country Doctor Community Health Centers was formed out of the blending of two separate and distinct organizations. Carolyn Downs Family Medical Center, which was founded in 1968 by the Black Panther Party, and Country Doctor Community Clinic, which was formed in 1971 by a group of community activists.
We do everything from prenatal care to doing our own deliveries to taking care of new moms, children, full pediatric services, as well as adults, geriatrics. And then we have some special areas of emphasis, but there's really nothing within primary care that we don't do.
The facility and everything was designed to meet the needs of the community.
So I came in and was very discreetly enrolled in the program, had the BCHP program, and had a mammogram which turned out to be cancerous, that I was cancerous. So, Country Doctor saved my life.
I used to, think I was important and I had an important job, and I'm telling you, when you wind up and you have nothing, that's when it's important to see how people treat you. And people here treated me so wonderfully and looked out for me, and really, were my emotional salvation, I think.
One indication of the importance of this clinic I saw again today. The waiting area was full of people, older people, adults, and lots of children. So the answer to the question, is this an important facility? The answer is obviously yes.
And it's the most cost-effective way of providing health care, which should be a right, not just a privilege.
Most of the time when I was working, I had insurance and such. And the first thing they ask you when you walk in the door is, what is your insurance? At Country Doctor, the first thing they ask me is, what's wrong with you?
There are pregnant mothers, there are children, there are elders, there are, men and women of all different ages, and, usually a couple different languages. And it just makes me feel at home there. It makes me feel welcome.
There will always be people who will be underserved. There will always be people who don't have enough insurance. There will always be people that need to be educated.
This was her first child, and in the course of reassuring her and giving her lots of education about this new child and vaccinating the child and doing all the pediatric stuff, I was able, as a family doctor, I was able to turn to the mom and ask her about her adaptation and how she was adjusting to being a new mother. And that led to a very fruitful discussion. We worked out a care plan. At the same time, she acknowledged that she wasn't using any birth control. She left there protected for her family planning services. That wasn't what they were here for. They were here to have their child vaccinated, but in the context of being a family doctor, I think to be able to help this woman's quality of life and help her better plan for her family in the future is very rewarding.
There are several examples of how Country Doctor itself has been responsive to community need. When the HIV epidemic, for example, hit, before people even called it HIV, we began providing care to the people in our community who were infected. When our community demographics changed so that the number of Spanish-speaking people increased, we added bilingual staff and staff interpreters. And that, to me, is what we're about. We change as our community changes, and we provide them the care that they need and deserve.
The reason that I think we need to have 51% of the patients served on the board, because the board also needs information, feedback from patients, that so the board can kind of hear from the patient's perspective what is their experience like, what need to be changed, what they need that is not there.
And then you get to walk through and see the people who are there being served, and it's a great feeling. It's why I wanted to be on the board, to be able to contribute to something like that. My part's a pretty small part of a very important organization.
I'm going to keep on coming to Country Doctor. I don't expect you to save my life every visit, but I really like it here.
The joy that I get from the work that I do and the people that I work with is worth a lot more than money.
To be able to cure rarely, to alleviate often, and to comfort always. That's what I get to do every day by working at Country Doctor Community Health Centers.